If you've been treating your knee pain with braces, creams, or exercises, but the discomfort always comes back, you may be focusing on the wrong joint. One of the biggest misconceptions about knee pain is that it always starts in the knee itself. In reality, one of the most common hidden causes lies several inches higher in a muscle on the outside of your hip called the gluteus medius. This muscle is responsible for stabilizing your pelvis every time you stand, walk, climb stairs, or balance on one leg. When it's functioning properly, it keeps your thigh aligned so the forces traveling through your knee remain evenly distributed. But when it becomes weak, the entire mechanics of your lower body begin to change. Every time you take a step, your body briefly balances on one leg. During that moment, the gluteus medius contracts to keep your pelvis from dropping toward the opposite side. If this muscle isn't strong enough, your pelvis tilts, your thigh rotates inward, and your knee follows that movement. Instead of bending in a straight line, the knee begins drifting toward the center of your body. It may only move a few degrees, but because the average person takes between 4,000 and 7,000 steps every day, those tiny alignment errors are repeated thousands of times over weeks, months, and years. That extra stress increases pressure on the kneecap, irritates the surrounding tendons, and accelerates wear on the cartilage inside the joint. This explains why many people continue to experience knee pain, even when medical imaging shows only mild arthritis. Pain isn't always caused by severe joint damage. Sometimes it's caused by the way the joint moves. Numerous studies have found that people with patellofemoral pain syndrome, early knee osteoarthritis, and chronic anterior knee pain often demonstrate significantly weaker hip abductors compared to people without knee pain. In other words, strengthening the muscles that control the hip can often reduce the forces acting on the knee itself, improving comfort without directly treating the knee. So how do you know if weak hip muscles are contributing to your pain? One of the biggest clues is pain while climbing or descending stairs. These activities require much greater hip stability than walking on flat ground. Another sign is difficulty balancing on one leg for more than 10 to 15 seconds. You may also notice your knees collapsing inward when standing up from a chair or squatting, or feel that one hip becomes tired long before the rest of your leg. These are all signs that the stabilizing muscles around your hip may not be providing enough support during movement. Fortunately, restoring hip strength doesn't require complicated equipment or high-impact workouts. One of the most effective exercises is the side-lying leg raise. Lie on one side with both legs straight and your hips stacked on top of each other, keeping your toes pointing forward. Slowly lift your top leg about 12 inches without rolling your body backward. Pause for 2 seconds before lowering under complete control. Perform 12 repetitions on each side. Although the movement appears simple, it directly targets the gluteus medius, the muscle responsible for keeping your knee aligned during every step you take. Next is the standing hip abduction. Stand behind a sturdy chair and lightly hold the backrest for balance. Keeping your upper body completely upright, slowly move one leg straight out to the side without leaning your torso or rotating your hips. Pause briefly before returning to the starting position over a slow 3-second count. Perform 10 to 15 repetitions per leg. This movement improves balance, strengthens the lateral hip stabilizers, and trains the muscles to activate while you're standing. The same position they're required to work in during everyday activities. Finally, perform the glute bridge. Lie on your back with your knees bent and feet flat on the floor about hip-width apart. Tighten your abdominal muscles, squeeze your glutes, and slowly lift your hips until your shoulders, hips, and knees form a straight line. Hold the contraction for 3 to 5 seconds before lowering with control. Complete 10 repetitions. This exercise strengthens not only the gluteus medius, but also the gluteus maximus and hamstrings, creating a stronger foundation that absorbs impact before it reaches the knee. Exercise is only one part of the solution. Long periods of sitting can gradually weaken the glute muscles because they remain inactive for hours at a time, a phenomenon often referred to as gluteal inhibition. Standing up and walking for just 2 or 3 minutes every hour helps reactivate these muscles and prevents them from becoming progressively weaker. Supportive footwear also plays an important role by improving lower limb alignment from the ground up, while maintaining a healthy body weight reduces the amount of force passing through the knee. With every step, even losing 10 pounds can significantly decrease the cumulative load placed on your joints throughout the day. It's important to remember that not every case of knee pain originates from the hip. If your knee suddenly becomes swollen, locks in place, gives way unexpectedly, or the pain follows a fall or twisting injury, those symptoms require medical evaluation. However, if you've been living with persistent knee pain that hasn't responded to traditional knee-focused treatments, it may be time to shift your attention higher. In many cases, the pain is felt in the knee, but the weakness begins in the hip. Strong hips create stable knees. When the gluteus medius keeps your leg properly aligned, every step becomes smoother. Pressure is distributed more evenly across the joint, and the tissues inside your knee experience far less stress. Over time, that can mean less pain, better balance, easier movement, and greater confidence during everyday activities. So before assuming your knees are the problem, remember this. Sometimes the most effective treatment starts with strengthening the muscle you never knew was involved. If you found this video helpful, give it a like, subscribe to the channel, and join us for more science-backed strategies to reduce joint pain, improve mobility, and stay active for years to come.